Hello, I'm Susan Cole.
And I'm Vanessa Apea.
And welcome to Health and Power, the monthly show on health inequalities affecting people of colour.
Thank you, Susan. And today, as always, we have some fantastic guests. I'm going to talk about one of them first of all. So we've got Yomi Olusunle, who is a writer, a brand strategist, and a psychologist. And she sits on the board of Terrence Higgins Trust. She's a UN Women's Delegate, a youth ambassador at One. And Yomi's work really focuses on championing health equity, mental health awareness, and neurodiversity inclusion, specifically within minority ethnic communities. So we are so excited to have her here today. And then we've got Dr. Faye Bruce, who is a senior lecturer at Manchester Metropolitan University, and that's in the Faculty of Health, Psychology and Social Care. She's the chair of the Caribbean and African Health Network in Manchester, and she's also the author of the book titled Decolonizing Public Health Through Praxis and the Impact on Black Health in the UK. So as always, we have some fantastic guests and I can't wait to speak to them.
Yeah, absolutely. It's so exciting who we have on this week. And it was brilliant to see you this week in person, Vanessa, at the anti-HIV stigma march, but at the same time, there was an anti-racism march going on that went past.
I know. There was two very relevant marches going on at the same time.
Absolutely. And last week it was the International Day for the elimination of racial discrimination. And I remember seeing that pop up on Twitter and thinking, okay, I'm going to write a tweet. I'm going to just nail some tweet on this issue. And then I just sat there for ages thinking about all of the different ways that people of color are affected by racial discrimination, in education, in health, all the issues that we're having with the police, all the stuff that's happening around the world. And it was so much, it actually felt overwhelming and I didn't do anything.
Well, that's the thing, isn't it? I think when you actually start to think about racism and how it affects one's life, you realize that it affects every strata of your lived experience. And I think that, when we look at structural inequalities and we think of those inequities, both that happen within the health system and outside of the health system, every policy and any intervention is affected by racism and racial discrimination. And so it is really difficult to know where to start. But for me, and I think, we said it before together, naming racism is one of the key things, because until very recently, there was a very core group of people naming it, but it wasn't broad enough. And I think that there's less silence and more talk about racism, and so I think any discussions about it are so important. And that really leads me on to Yomi, who we've got on today, because Yomi does fantastic work about addressing inequalities, particularly in the mental health and neurodiverse space. And when you're focusing on the care of ethnic minority communities of color, racism is clear, it's front and center there. And so I'm looking forward to hearing about her perspectives and what she does with this as well. So looking forward to it.
Can we bring on Yomi?
Hello.
Hi, Yomi. Thank you
so much for having me. I'm very excited to be here.
It's absolutely
wonderful.
We're
very excited to have you.
Yeah. So Yomi, people of color are disproportionately affected by mental health problems, but less likely to receive support. And actually, I think it's like Black people are 4 times more likely to be sectioned under the Mental Health Act. What do you think is actually driving these health inequalities?
I think multiple things are driving health inequalities in the society that we live in. It's top, bottom, top. It's everywhere. It's very layered. So I think first of all, there is bias. And I'm not saying unconscious bias, because unconscious bias is when people don't know, but there's actually a bias towards Black people. A lot of healthcare providers, a lot of healthcare professionals don't necessarily address the needs of Black people because they have a particular perspective of Black people and minority ethnic groups which struggle with mental health conditions. So they expect aggression, they expect a certain type of behavior. Another thing is also, the lack of cultural competence. And when healthcare providers lack cultural competence, it feeds into intersectionality, because when you're not culturally competent, you can't address intersectionality. And for a lot of Black people, we're very nuanced. We're not a monolith. So, there's Black female immigrants, there's Black and Latin and Black people who are mixed with who are also of Latin origin. There are Black immigrants, so there are all of these nuances. And when healthcare providers don't have the cultural competence to address the nuances of the experience of being a Black person or a person of color, it also plays a part. And there's research to show that a lot of Black people who go into mental health services to seek care, because there's hardly any representation, and there's hardly any representation, and there's hardly cultural competence. They spend more of the time they are meant to be using to access care to be explaining the impact of racial inequalities, the impact of stigma, the impact of patriarchy, the impact of misogyny upon them, instead of just accessing the care. So it makes the experience way longer for them. So for me, I think those are some of the nuances that impact this.
Thank you, Yomi. Completely agree. It is multi-layered, and I like how you make the distinction of bias and not unconscious. There's definite conscious bias that's there that is driving some of this. And when you mentioned about representation and drawing that out as being important, and I'd like to talk a bit more about that with you. In terms, there's a lot of more discussions about raising and developing more psychologists such as yourself, psychologists of color. And so could you talk to me about what you think the importance of it is?
I think the importance of it is everywhere, because when people see psychologists of color, therapists of color, we definitely feel more comfortable. We definitely feel more seen. We definitely feel more understood. There's the saying among a lot of Black people that when they are taken into the healthcare system, they are not taken in to be taken care of, but they are taken in to die, which is a very strong thing that people strongly believe in. We can see all of this in the justice system, in the criminal justice system, how Black people are, seen as criminals before they are seen as people who struggle with their mental health. And a lot of people just feel safer, and we just feel more connected when we see people that look like us, see people that sound like us, see people that understand us. Because when you're a psychologist, you also have to be in therapy, and you also have to go through the therapy process. And I've had the privilege of speaking to quite a few therapists. And in terms of cultural competence, I find that when speaking to or when working with white therapists, it's just so long, and therapy is expensive. So if you're paying for 1 hour and you're spending 45 minutes talking about, all of the nuances that have brought you here, then when do you actually have the time to get the care that you want? But in terms of representation, sometimes strong empathy stems from representation, because you see someone that sees you, that hears you. When we look at Black maternal health, and we look at how, Black mothers are dying, Black mothers have complications during pregnancy, and they are not addressed. There's the trope of the strong Black woman. There's this trope of being strong, being able to be survivalist, expressing pain, and all of that. But when you see someone that looks like you, that understands you, that has been there, or has a sister that has been there, or has that knowledge and experience, it definitely makes the process way easier and way more accessible. And then even the biases, the stigma that exists within our communities is reduced, because when you see your cis being like, you should go to therapy, you feel more comfortable than, someone who you don't think understands. You're a white person saying go to therapy, you're like, do you think I'm crazy? So it's just things like that.
Yeah. And Yomi, you've shared your experiences of being diagnosed late and with ADHD. What's been the impact of talking openly about what's happened with you?
I think the impact of talking openly about it, first of all, is that it's encouraged other people, especially, people of color, minority ethnic groups, like my friends, my community, people who know me, to seek support or seek help, or say, you know what, I think I have some of your symptoms, or I think some of these things are going on with me, so I need to seek support. I also think that it's come with very mixed feelings. So people don't quite know what to do with me, because, ADHD has a very niche ADHD has a very niche perspective. So within the healthcare system, among people in general, people see ADHD as something that happens to hyperactive, small white boys. So when you see, like someone in her mid-20s, a Black woman, an immigrant with ADHD, it's like, you don't quite know what to do with me. So I think in general, my experience has been very mixed. It's been very positive in the sense that it's encouraged people to also find out about themselves. I have more peace. I'm able to advocate for myself better, get, the needs, the reasonable adjustments that I need in the workplace, in life, understand myself better, and know when I'm, when I'm going beyond myself and knowing when to pace myself. But it's also, been quite negative, because there's always the bias, there's always, the way that you're seen. But for me, my faith has to be bigger than my fear, and the impact of sharing the story and what it will do to people and within the Black community, and how, we can all collectively seek support and destigmatize neurodiversity and mental health, is more important to me than just my story, because this is bigger than me. So
that's fantastic, Yomi. I think that's how we change things, I think, as well, when we share. And your analogy of people think of ADHD as a little white boy that's running around. It's true, and it's an image that many of us can relate to in terms of what our family members may think of it. So I know that, I'm sure you've definitely changed the narrative. And just kind of drawing on that, is that, so you're one of the UN women delegates, UK delegates to the UN mission on the status of women, and that's amongst so many of your incredible achievements. And I think that you standing out there and being an activist, it's incredibly powerful. So what advice would you give to another young Black person who wants to make a difference through activism?
I think my advice will be, pick your battles and pick them very wisely. Because there are a lot of things to be upset about. There are a lot of things that are happening within the ecosystem, within the global ecosystem, that require change. But you can't burn yourself out. So pick your battles, decide on the causes you're passionate about and the ones that are the most meaningful for you, and pursue them, and also bring joy into your life. Ensure that the life you live is filled with joy, because activism can often be very lonely. It can be very heavy, when you have to write articles or tell stories, or, advocate and do research. There are these heavy topics that sometimes we have to go into and talk about. So invite joy in your life. Make sure every single day you're doing something that makes you happy. Pick your battles very, very wisely. I remember Ketanji Brown saying this, and I read Michelle Obama's book, and she said the same thing, because, and just know that you're changing the world by, no matter how small your work is, and that's it. Yes.
I think that's so important, and I can completely relate to that. And actually, I'm going to follow your advice in my activism and pick my battle. So thank you so much, Yomi. It's been an absolute joy having you on.
Thank you so much for having me.
That's been great.
One of Yomi's incredible achievements is being a trustee of Terrence Higgins Trust, the HIV and sexual health charity. And they're doing a lot in relation to encouraging people to know about PrEP and to go on PrEP where appropriate. But so often people of colour and women aren't really getting this message. But I think that you've been doing some work, Vanessa, to fix that.
Yeah, no, completely. First of all, in terms of what you say, is that we have PrEP, which someone can take, and it can stop them getting HIV. And this has been a game changer. You know, it's a term that we say all the time. It's been a game changer in HIV prevention, but not everyone knows about it, and not everyone gets access to it. And when you look at it, again, women don't access this as much as they should, and also Black women particularly. And so I've been doing some work with another fantastic organisation, Positive East, based in East London. And I have to give a shout out to the coordinator for the project, Pamela, who has been doing a project with us called Women for Women. And essentially, we have worked with colleagues at Queen Mary University and Barts Health to train up Black African and Black Caribbean women in the community to learn about PrEP, and then also to explore why women are concerned about taking PrEP, and why they're, you know, what are the barriers, and then they are then going to be spreading the word within their communities. And it's been such a lovely project to be part of. Yeah,
that is very cool indeed. Well done.
It is.
So,
yeah.
Should we bring on Faye? Hi, Faye. Thank you so much for coming on.
Pleasure. Thank you so much for inviting me.
We're very excited to have you on today. And Faye, one of the reasons that I was, for many reasons, I was excited, but I was doing some research, and then I saw your book. And I was really, really proud to see it. And it was just decolonizing public health, you know, such a powerful topic. And I just wanted to just hear about what led up to you writing the book, and what were your main findings, because you really focused on the impact of the health of Black people. So it'd be great to hear more about it.
Sure, yes, of course. So, gosh, it's such a long story that's leading up to this book, and we haven't got time, of course, to kind of go through all of that. But in essence, so I'm a clinician by background, so I did my nursing, gosh, and I don't want to say the years because everybody will guess how old I am. However, I was one of those first ones to do the nursing degree years ago, just around the time of Project 2000. But it kind of started really because I wanted to be, you know, and sometimes it's a bit of a cliche when we hear, oh, I want to be a nurse because I want to help people. But actually, me being brought up in the church in Manchester with my parents that had come from Jamaica in the 60s, and kind of growing up and seeing so many of our community people actually having so many health issues, you know, when they were really quite young, in their 30s and 40s. You know, sometimes you'd hear them in my dad's kitchen, you know, their partners really wailing about somebody who passed. And I just was really scared, you know, thinking what's going to happen to my parents. I was very young, you know, there were 7 of us in our family, and I wanted to find out what was going on. You know, I wanted to know what was going on that was leading to all these people, you know, having these health challenges so young. And I'd always wanted to get into the health field to see what was going on. What was going on when these people were going into hospital? You know, and it's that thing where, you know, so many times we hear our community people saying things like, I don't want to go into hospital because I'm going to go into hospital and I'll never come out alive. You know, there's this real fear that's been going on for generations. And I was one of those people that wanted to get in there and do something to change the experience of our communities. One of the things that I did, kind of leading up and trying to cut this down very, very short, was about how that experience, you know, what could I do to really change that experience of those Black men and women that were having all these health issues. And I did a master's at the University of Birmingham, which was trying to understand, if we have all these cardiovascular issues, if we have all these issues around mental health, what is the actual then primary care trust doing to actually engage with our community to try and stop this from happening? And that piece of research actually told me that there was very, very little. They were not engaging with our communities. If you had some information that went out there about, I don't know, diet or something else, it wasn't tailored and targeted to our communities. They just were not engaging. So I kind of wanted to pursue this even more. I just thought, right, okay, that piece of work has revealed this. What do I do next? And so I then went into to do my doctorate. And it was my doctorate where I was asking all of those questions. I had hundreds of community people. And, you know, people say, oh, Black people don't do research. They don't engage in research. But actually, dangle a bit of food.
Absolutely.
It was the kind of thing when I said to people is, I don't want my doctorate to sit on the shelf and nothing happened with it. I want to do something with it. I couldn't promise what it was, what it looked like. People engaged and they came back. I asked some questions. What's kind of creating or causing our health issues to be, you know, maintained? Why are we still suffering from these cardiovascular events, strokes, and everything else? And Calm was born as a result of some of those consultations that I was doing, because it was an absolute. You know, you sit there, you come back and you analyze all this data, and you're thinking, wow, this is so rich. And then I unpacked it further with a small group of people who became my directors for Calm. That's just how this organization started. So what this book really is, so as you know, Calm has now been around for 6 years this year, and we have just growing from strength to strength. We are really looking at those health inequalities that are impacting our community. So the public health issues and actually holding the systems to account to do something. Because I very, very much believe that much of what goes wrong is because of the benchmarking that we are subject to, the benchmarking populations that we experience. They're not speaking to us, they're not targeting us. So we are there to be the voice. And we're not saying we represent everybody, because we know that there's such diversity in our communities. However, when we talk about racism and discrimination, whether you're Black from Jamaica, Black from Nigeria, Black from wherever, the issues are the same in terms of our experience. So how do we, as a Black-led organisation, challenge the system to do something about, you know, what we need to have changed to improve our health and well-being? So the book then became very, very much about decolonisation of public health through practice. So it's very, very much about the experiences of our Black people, and how do we shift those colonial ideas and those colonial powers to be able to say, actually, some of our traditional health, you know, beliefs and practices are the things that we know help. Why are they not valued and credited? Why is this colonial ideal being the one that's being pushed forward? So that's in a real nutshell what this journey is being like, with lots in between.
That's amazing. And I can totally relate, particularly in terms of our elders and that fear of going into hospital. It's certainly an issue that I've had when my mum's become unwell. So what changes do you think need to happen now in the health service to make things better for us as people of colour?
Yeah, we definitely need to be more visible, more around the table. We don't have the representation, and I often, so in one of my roles, I do sit as one of the non-exec directors, I pushed my way to that position, to be honest. I said to the chief exec, you know, he talks about leadership programs. I said, it's not leadership programs that we need. You know, I need to be sat around, we need to be sat around the table to influence those decisions that are being made, and to be able to not just kind of tag on to things that are being said or what other people put forward, but from a grassroots perspective, from those lived experience, we need to be bringing those to the boardroom and ensuring that there is a grassroots approach from the bottom up to the boardroom, that we actually do something about it to make the changes. So, and I think it's very, very much the case that we need to have the lived experiences to be able to articulate what that looks like and what that should look like for that everyday person walking down the street that is suffering with their health or not being heard or not, you know, being considered for whatever reason. So it's very, very much about representation, but being strategically influencing what is happening at the very highest level. We need many, many more of us doing that. And we also need to make sure from our children, I mean, the previous, you know, lots of conversations about, you know, how do we prepare our children as well and stop that intergenerational cycle of trauma that we experience? How do we encourage, build confidence, resilience within them, so they grow up completely different to, you know, what the experiences that we've often had, which are very, very unpleasant. We see it all the time.
So it's exactly what you say about people being at getting a seat at the decision table is just absolutely crucial. And, you know, sometimes people from our communities face barriers when they're trying to get a seat. And I love just hearing what you said, is like going there and saying, I want a seat here. But sometimes people don't know that they can do that, and they don't know how to do it. And sometimes then, even when you've got a seat, you've got kind of a wobbly seat. So your engagement feels a bit tokenistic on that occasion. So what advice would you give to someone who wants to make a difference, but doesn't know how to?
I think working alongside people that have been there, I think that there's very, very much, I think there's a need to have like a buddying system. There needs to be people that have journeyed and been there to be able to support those people, because I think no matter what, we need them around the table, and we need them to be vocal, confident, to be able to speak up, to say it as it is. You know, I challenged today, why haven't you signed up for the anti-racist charter? Why have you not? I look now and I stop and I say, what have I got to lose by speaking up? And I think that the more we can kind of support and guide people and enabling them to say, actually, it's not easy. I mean, we hear about people that are at the top that are faltering or that they don't feel supported. One person said to me, you know, I'm here and I'm at the top, but it's very lonely. It's a very lonely place. I just need some support. I just need people like you to wrap their arms around me and support me. And I think it's very, very much about, yes, we need you there, but let's see how we can collectively support people when they're in those positions. It's not easy at all.
No. Absolutely. I mean, I will agree with you 100%. That's, very helpful indeed. Thank you so much, Faye, for joining us today.
Thank you so much for having me.
Great, thank you.
Oh my goodness, I can't believe we've run out. We've run out of time.
They were fantastic as well. We're so lucky. I think we've had such amazing guests each month, and it's you always feel it's the start of the conversation, as I always say. But anyway,
I know. Yes. So I'd like to say a huge thank you for everyone who has joined us today.
And I really, really want to thank Yomi. I want to thank Faye. Yay to you, Faye. I want to thank Faye. I just think having your insights, but it's also honest insights that I think that just really support people as they're listening. And it's just incredibly interesting just to hear people's lives and how they've come into this health equity space. So thank you so much.
Absolutely. And so much of it is so pertinent and relatable for the vast majority of us, I would say. But I would also like to say a big thank you to the National Lottery for supporting us doing this, and to Disruptive Live for their technical wizardry, and luckily nothing broke this time, so thanks very much. And I'm really excited about our next episode next month, because we're going to be joined by Dr. Halima Begum from the Runnymede Trust.
We are indeed. We also have a fantastic colleague of mine who will be talking about hematology. So I'm really, really excited as well. So it's going to be a fantastic show again.
So thanks very much, and we'll see you the next time. Bye.